My name is Andrzej Jakubowiak. I'm here at ASCO to present the results of our phase 2 randomized international trial in which we evaluated the impact of new and exciting antibody elotuzumab in combination with bortezomib and dexamethasone. The study was just presented. I'm happy to share with you those results. So we have heard that after an era of impact of proteasome inhibitors like bortezomib and now carfilzomib as well, and then immunomodulatory drugs like thalidomide, lenalidomide, and pomalyst, there was a sense of need of adding new class of drugs to make further improvements, and antibodies emerged as potential most exciting, most impactful candidate in this regard. And among the few antibodies which are more advanced in development, elotuzumab is one of those which have been already mature enough to bring for this ASCO two extremely important updates, including the one which we are discussing, in which we are in more rigorous way verifying or trying to look at the prior preliminary results and validate them in a randomized fashion. For this particular study, we have earlier looked at the possibility of elotuzumab interacting with bortezomib. Let me tell you what elotuzumab is maybe first. This is a very specifically targeting myeloma cells and plasma cells antibody. There is a receptor which almost exclusively is present just on plasma cells and a small proportion of some of the lymphocytes, T cells and NK cells. And that target used to be called CS1. Now we use maybe more appropriate name SLAM F7. And because of the specificity of this target, elotuzumab have emerged as extremely attractive candidate as an antibody to work with anti-myeloma agents. And we have generated very good preclinical data for both combining this antibody both with immunomodulatory drugs, which for many was more natural because of the effects of these drugs on NK cells, very important in mechanism of action of this antibody, but also with bortezomib, with Velcade. And those preclinical work have shown a clear synergy between these two agents. Then we had already published work in clinic in phase 1 fashion, in which there was a promising, as usually for single arm phase 1 studies, but a very clear signal of synergy between bortezomib and elotuzumab. And that particular study was set to verify whether those initial impressions were truly verified in more rigorous and randomized fashion, and that's what we report.
And what population was this study done for?
So this was done in patients who relapse with 1 to 3 prior lines of therapy. So in fact, most patients were treated after their first relapse. And the study setup was that the study was conducted internationally. I was leading this study. This was company study. Bristol Myers Squibb developed this study, but I was very much engaged to develop the concept and study design, and happy to be contributing to it in this way. In the international context was to enroll the studies as quickly as we can, so we'll have results as quickly as we can, and it was successful. Most of enrollment was outside the United States. My institution, University of Chicago, where I lead myeloma program, led American effort, and we are able to generate the data which were just presented.
Any toxicities?
So first and foremost, the study is positive. So we have confirmed that additional elotuzumab to bortezomib and dexamethasone impacts on primary endpoint, and primary endpoint was progression-free survival. Progression-free survival was significantly improved as per study design, by very much respectful hazard ratio. It's very much statistical term at the level 0.72, which means that there is a 28% probability of reduction or improvement of progression-free survival compared to treatment of patients with bortezomib and dexamethasone, which is practically by several months improvement, which is the main outcome of this study. Toxicity is an important aspect of it because we have a study with two almost impossible goals to achieve and match in one study. One, there is a positive study and improvement. At the same time, there seems to be no added toxicity. So we have improvement for free almost, one would say, from the toxicity perspective. There were maybe few infusion reactions, which are for the most part limited to very few patients and only in the first period of infusion, first cycle, with the premedication which we use. And otherwise, we don't see, when we look in parallel for toxicity, any difference between two groups, with or without elotuzumab. And there is a number of patients, including one of my patients who is now for over 3 years on this treatment, that I don't see any added toxicity, and we historically have not seen any added toxicity from elotuzumab. So there is a clear contribution of elotuzumab to bortezomib and dexamethasone. And it is exciting to us, and I think it is exciting especially in the context that elotuzumab will be reported, so I cannot really speak about details of the other study, in a couple of days at oral session, to have, we know it already, a positive impact also after combining with lenalidomide dexamethasone, Revlimid dex, in larger phase 3 randomized trials. So we have two studies supporting each other and making a very significant exclamation point what we were predicting, that we do have a new drug which is active in combinations. Of note, it was not much of activity of this drug as a single agent, so we have example of agent which have not necessarily been active on its own, but it's very much increasing duration of response, in particular in progression-free survival, and clear trend for overall survival in two studies. So we have an exciting moment at this time. First, evidence from randomized trial that antibody can improve at least progression-free survival, and there is a sense from my study, overall survival. It's too early to really claim it, and you will see about overall survival reports from Revlimid dex study in a couple of days.
Very exciting.
It is exciting.
What's next?
So I think that there are a few implications for this results from this study and for Revlimid dex Eloquent 2 study. Number one, that we have antibody which we can combine both with immunomodulatory drug like Revlimid and bortezomib. So whenever there will be, and we anticipate the next step will be in FDA hands, which everybody expects that those two studies will provide enough support to approve